COVID-19 caught the world by surprise. But for a small selection of countries that were very well prepared, COVID-19 actually did come and had much lesser impact to those countries. Thailand was one of them. Thailand had very fantastic public health preparedness for an outbreak of the nature and of the scale of COVID-19. The distribution of community health workers, both in the rural and the urban parts of Thailand, ensured that primary care services continue to provide a very important safety net to keep the Thai people safe during the COVID-19 crisis. So Thailand, we can see the outcomes, the number of deaths, the very low number of infections in Thailand really highlighted the success that Thailand has in handling a global pandemic of the nature of COVID-19. Congratulations and very well done both to the Ministry of Public Health, to the government of Thailand and to the people of Thailand for having contained and continue to contain the crisis. We continue to look to Thailand for lessons in coping with COVID-19.
Hello. Thailand, a country of 66 million people, has so far had fewer than 4,000 confirmed cases of COVID and 59 confirmed deaths. Currently, local transmission is virtually zero and all new COVID cases are imported. How do they do this? Well, Thailand built on a very successful, world-renowned universal coverage scheme. They've built on the scheme and used their very unique Thai way to engaging private and public sectors, academia, and the general public and civil society, and through a number of measures, including a fairly effective tracing system, as well as the ability to recruit village health volunteers and convene and deploy rapid response teams. They've been quite successful in tracing cases and in preventing further community transmission. They started early screening the minute the outbreak was declared in China, and they've run education campaigns across hospital staff and public health workers, as well as members of the public, making sure risk is communicated adequately and people know what they're supposed to be doing. This whole society approach was unique, I think, in ensuring that the Thai response was as successful as it has been so far. So Thailand has applied evidence to policy mechanisms and processes, as it did during peacetime, during the outbreak, and it's been very successful in doing that. An area where unfortunately other countries, including perhaps the United Kingdom, with a great tradition in using evidence to inform practice, has been much less successful in doing. Thank you.
My name is Daniel Curtis, World Health Organization representative in Thailand. There are obviously many reasons for Thailand's success so far in managing the COVID-19 pandemic. If I had to highlight one, I'd say it was because Thailand played the long game. For 40 years, the Royal Thai government committed to and invested in good primary health care, universal health coverage, and preparing for epidemics. When COVID-19 came to Thailand, the system was ready to test, isolate, and care for every case, and trace and quarantine every contact. Health professionals across the country, with support from village volunteers in the community, were there to stop the spread of the virus. Strong health systems are the backbone of any pandemic response. Of the many reasons for Thailand's successful COVID-19 response so far, surely the country's long-term commitment to the health of its people was one of the most important. Thank you.